Hi, good morning, good afternoon, good evening to all of you. Thank you for joining us today for the Humanitarian Assistance Evidence Cycle second webinar in our three-part series, Navigating Constraints to Impact Evaluations in Humanitarian Contexts. We're just going to give it about 30 more seconds for the rest of the waiting room to filter in, and then we're going to kick it off. We have a pretty jam-packed agenda today, but we will absolutely be completing on time. While you wait, we would absolutely love if you could open your chat, introduce yourself in the chat with your organization, title. And I'll also take this moment to say our chat will be actively moderated by some of my colleagues on our activity. You'll see the name HAEC, or is what we call HAEC afterwards. So please use that for Q&A throughout today's 60-minute webinar. We're not going to have live verbal Q&A, but we really are excited to have an active chat during this morning's presentation. And with that, I'll kick us all off. So this is the second in the series, as I had said. We are the Humanitarian Assistance Evidence Cycle called HAEC. HAEC is an activity that is funded by USAID's Bureau of Humanitarian Assistance, or BHA. And really the purpose of the HAEC activity is to promote the increased utilization of impact evaluations, really to improve the cost effectiveness and quality of humanitarian programming globally. We do a number of different things. We have resources and tools available. We do trainings around impact evaluation, and we also are funding impact evaluations globally. So we have 4 currently going on in Latin America and 2 in West Africa. You're actually going to hear from our peers and colleagues at implementing partners and researchers from those impact evaluations of BHA-funded awards today. So we're really thrilled about that. Where we sit in the series, and I'm sorry, my name is Lloyd Banwert. I'm with an organization called Tango International. We're one of 4 consortia partners on the HAEC activity. The other 3 are Causal Design. You'll hear from my colleague Christy later today, who sits at Causal, Save the Children, and 3IE. And lastly, we'll be dropping a number of links throughout the presentation today. Don't worry about clicking on those and bookmarking them if you're trying to multitask. We will make sure all those links make it in the end of event email as well. So next slide, please, Katie. So where we sit in the series. So in January, we had our first webinar series that really focused around what is an impact evaluation and what that looks like in the humanitarian space. Katie will be dropping in the chat just now a link to that recording. Feel free to watch that if you didn't attend in January. Today, we're really talking about how we conduct impact evaluations in these humanitarian contexts, specifically around navigating the constraints and barriers to doing impact evaluations. And then our last webinar that's going to be in March is focused around why do we do these impact evaluations and how do we use the findings to actually improve our humanitarian programming. Before we get into the meat of the content today, we're really excited to have Arif Rashid, who is the chief of the Design, Monitoring, Evaluation, and Applied Learning Division at BHA, to give us some opening remarks around impact evaluations from USAID BHA's perspective. So Arif, over to you.
Thank you, Lloyd. Good morning, good afternoon, good evening, depending on where you are calling from. I am really excited to welcome you to this timely webinar that will discuss how can we navigate constraints to impact evaluation in humanitarian context. In BHA, or Bureau for Humanitarian Assistance, in USAID, we really focus on evidence-based design or evidence-based programming. We would like to improve effectiveness of our responses and activities. And as we all know, working in the humanitarian context, the evidence based for intervention or intervention packages is really quite thin, and compared to the intervention that we used in the development context. And there are many reasons why we do not have adequate evidence to support the interventions. There are ethical challenges, pace of the emergency activities, attrition rate, contextual challenges. All these make it very difficult to design and implement high quality rigorous research or evaluation. So as a result, if you look at the literature, you will find that there are very few impact evaluation compared to the development context that were done in the emergency context. And we understand that often we face challenges to spend humanitarian resources on study or research. But if these studies and research help us to identify the most effective intervention or a set of interventions, then we would be able to reach out more people. Our investment will be able to make more meaningful changes to people's lives. So, that will go a long way in terms of achieving our goal and objectives. So I understand that in this webinar, HAEC will discuss some potential approaches to design impact evaluations to identify effective interventions or intervention packages. Considering some of the challenges I mentioned, but there are many other challenges that I am sure you will learn and you have been experiencing as you are implementing emergency programs or evaluating emergency programs. While one of the key aspects that we all are keenly interested to find out, how can we utilize the monitoring data to inform impact evaluation, right? We all do monitoring to understand our performance, and how can we design the monitoring system, the survey we do so that the data we gather is very high quality and that can contribute to the impact evaluation. So that's I hope that that's one of the topics that will be discussed in this webinar. We also, think about when we talk about impact evaluation, we always or often we are tempted to thinking about, how do we really ensure control, right? So treatment, we have a treatment group who are going to receive the support or services from your activities, but then how do we ensure control, considering some of the challenges I already mentioned, right? Ethical concerns, there are contamination opportunities or many other challenges we face. So again, I believe that this webinar will discuss some of these. How do we navigate through these practical challenges that we practitioners face as we design and implement impact evaluation in the context of humanitarian assistance. USAID recently established an office for chief economist, which is housed within the agency front office, and they are helping the bureau, helping the agency to generate and use evidence on cost effectiveness. So in BHA, we have been partnering with the Office of Chief Economist also to get their input, get their technical support in designing impact evaluation, considering or generating evidence, considering some of these challenges. So there will be opportunity for HAEC or us to interface and take input from the Office of Chief Economist as we move along. like I do not want to take too much time, and cutting short of the time that we are waiting to hear from the speakers of this webinar, I would like to express our thanks to the HAEC team for hosting such an interesting and timely webinar. I understand that, in addition to the face we are seeing on the screen, there are so many other people work behind the scene to make this webinar a successful one. And finally, I would like to thank you all for taking time for your busy schedule. Some of you probably calling late in the evening from Asia or late in the afternoon from Africa. So really, really appreciate your time and interest to participate in the webinar and, make it a successful one. So with that, thank you all. I wish all the best. Back to you, Lloyd.
Thanks so much, Arif. I'm really excited to say that our webinar today, unprompted actually, is addressing each of the points that Arif brought up around these challenges, around cost, utilization of existing data sets, concerns around ethics with treatment and control groups. That's all going to be covered by our practitioners today. And I'd also equally like to express our gratitude to Arif's division and the Bureau and BHA as a whole. They've really been at the forefront of bilateral donors and supporting this type of research in the humanitarian space. We're seeing initiatives pop up in a number of different bilaterals and multilaterals, but BHA has really been pushing that envelope a lot, and we just want to commend them for that. Yeah, so constraints. How do you implement a rigorous impact evaluation in these humanitarian settings? At HAEC, we recently published a report around 10 core constraints that we identified after consultations with nearly 70 implementing partners and researchers. And we've distilled those down into these 10 buckets, and we discussed them at length in a report. We'll make that available to you. I'm sure it's in the chat in just a moment here. Today, we're really going to focus around 3 of those constraints. And so, rather than us just talking at length around it, we want to hear how our implementing partners and researchers have explicitly navigated those constraints. So we're going to hear around ethical concerns from the Mercy Corps Nigeria team, and how they set up their control and their treatment groups and what that looked like. We're going to hear around lack of funding and how to drive down some of the costs that are associated with impact evaluations from the IAPS team in Honduras. And we're also going to hear around low implementer bandwidth. That's where your M&E teams are just taxed with numerous requests and from country offices and donors and HQ. And from that, we're going to hear from Bluemont, Colombia. And so now I'm going to hand it over to my colleague who's leading this award with me, Christy Lizicki at Causal Design. Christy, over to you.
Thanks, Lloyd. Hi, everyone. As Lloyd mentioned, I'm Christy Lizicki, and I'm the Director of Impact Evaluation at Causal. And I'm going to kick us off by talking about this first constraint, ethical considerations. So during our consultations, a response that we heard a lot from stakeholders when we were asking them what they thought about impact evaluations in humanitarian settings was that they are not ethical. So before we unpack that, we want to throw this question to you. What do you think? Can impact evaluations in humanitarian contexts be ethical? So you should see a Zoom poll popping up on your screen now. So we invite you to answer the question. So again, can impact evaluations in humanitarian contexts be ethical? And the answer choices are yes, no, and I don't know. Let's give a couple seconds to wait for responses to trickle in. And don't worry about what you think. Safe space here. Okay, I can see the answers are pouring in. All right, Okay, so an overwhelming majority of you agree that they can be ethical. Well, we're excited to hear that. We agree with you. And let's unpack why, so we can share some knowledge, equip you with knowledge to share with others that may not be sure of the same thing. So in our consultations, we really heard two major concerns around the ethics of impact evaluations. The first was this idea that there's this direct trade-off between research and aid. In other words, any money that goes towards research is directly taking away from life-saving aid that can be given out. The other big concern we heard a lot about was that impact evaluations require withholding programming from a group of vulnerable people. In other words, you need to have some sort of control group of people that aren't receiving services. And this ethical dilemma that we observed is really illustrated by this quote from our report here, which says, there's normally a universal approach to coverage for humanitarian response that makes having a control group really hard. Everybody that needs attention should get it. So let's debunk these two myths for you. So first, this idea that there's this direct trade-off between research and aid. So more money, more research means less aid. We would argue that's probably not the right way to think about it, and actually it could be the opposite. So inherently in any resource allocation decision, there's trade-offs, right? There's limited money, you have to pick and choose. So if you choose to fund program X, that means you chose program X and you didn't choose program Y. But how do you know that program Y wouldn't have been better? And so we're really advocating for impact evaluations because they can answer that very question. They can tell you, was X more impactful than Y? Was it more cost effective than Y? And so this tool, impact evaluations, can really help optimize programming such that you can stretch aid to reach even more people. Then the second concern around requiring to withhold programming from a group of vulnerable people. You might recall, if you attended the first webinar, that we talked about how impact evaluations can actually be designed in a way so you don't have to withhold services from anybody in the study. And so I'm going to do a quick recap of what that impact evaluation was, just to remind everybody of that. So we like to think of impact evaluations in two broad classes. So first is what we call impact evaluation of a program. And this is probably the impact evaluation that most people are familiar with. And they answer the question, does the program work? Does the program change outcomes in the way that we were hoping to change outcomes? And the way that these questions are answered is by comparing a group of people that get the program of interest to a group of people that do not. And typically the objectives of this type of impact evaluation are to contribute to a larger body of knowledge of what works. But there's this second class of impact evaluations that we like to call impact evaluation of a program change. And it answers the question, not does it work, but how do we make it better? And so to answer that question, rather than comparing a group of people that get the program to a group of people that do not, you're actually comparing a group of people that get one version of the program to people that get a different version of the program. So program version A versus program version B. And you could answer questions such as, is A more impactful than B? Is A more cost effective than B? You know, if it's more impactful, let's scale that up. If it's not, well, then our money is better used elsewhere. And so you can see that these types of impact evaluations are really can be used for optimizing. And this type of impact evaluation answering this question is very commonly called A/B testing. You've probably heard that term before. And so with that, I'm actually going to turn it over to the Mercy Corps team, to Grace Chibet and Vi Krishnan, to talk us through how they use this A/B testing impact evaluation approach to overcome an ethical concern and answer a really important question for Mercy Corps. So over to you both.
Thanks, everyone. I'm Grace Chibet, and today I want to talk about the ethical concerns of conducting an impact evaluation in a humanitarian context. Some of you are wondering, why should we do an impact evaluation in a humanitarian context? This is because humanitarian crises to grow in number and affecting a large number of people. We want to understand if our interventions are very much effective, but doing an impact evaluation in such contexts also comes with its unique challenges, as we all know. Some of this is around having a pure control group. If we are to understand if our interventions are effective, then we may need to compare this with one group that doesn't receive any intervention at all, which in this case is the control group. However, in humanitarian context, this is actually a very ethical challenge. So the context where I work, that is Borno State in northeast of Nigeria, is a protracted crisis context. I want to share my experience with you today of the ethical challenges we faced and how we resolved it. Just to bring you in closer on what we're experiencing in Nigeria. We have a great insurgency in Nigeria with armed attacks and conflicts. And this has been happening for over a decade now, starting as from 2009. This has led to a large number of displacements and people in need. So far, we have over 2 million displacements in country. This includes displaced populations, the IDPs. We also have host communities and also returnees that are trying to go back to their areas where they belong. So simply providing humanitarian aid is not sustainable, looking at over 10 years insurgency. So we need to help people move towards rebuilding their livelihoods and rebuilding their lives. And this is the direction that most actors, including donors, have started to take to. Graduation approaches from humanitarian assistance into out of humanitarian aid and early recovery. With this in mind, Mercy Corps last year, as from around April, we did start a program called the BEGE program. BEGE stands for Broadening Emergency and Graduation Efforts. And its main aim is to transition vulnerable households out of humanitarian assistance. The main goal for the program is to enhance adaptation of over 200,000 displaced persons. And how are we doing this? We're looking at multisectoral approach. Multisectoral approach that we are taking in this case is the layering, sequencing, and integration of different approaches on top of one another to the same participants, so that they can be able to get their immediate assistance and at the same time also start putting in approaches so that they're able to start fending for themselves, hence realizing economic resilience. So approaches like providing food assistance during the lean season, training participants of approaches, including agricultural training, and also provision of small ruminants, arable farming, and poultry. And also we're doing something on cash transfer. Our theory of change was that by providing this assistance, multisectoral assistance, in a certain number of months, we could actually graduate people out of humanitarian aid into early recovery. But we did take a step back just to evaluate what we had in our theory of change. And this question came to mind. Is these interventions that we're doing effective? All this package put together, is it effective? How would it work to actually enable us proceed and graduate participants into early recovery? Let me welcome my colleague Vi to take us through the next steps after our thoughts.
Thanks, Grace. Yes, so just to confirm, the questions like Grace mentioned, what we were trying to understand is does this approach of providing people with food, cash, livelihood skills, does that work to help graduate people out of humanitarian aid into early recovery? And so the research team and the program team at Mercy Corps, we collaborated and we talked about adding a life skills training. Now, this life skills training was something that Mercy Corps had piloted in Iraq, and we'd had some very good results. So while life skills is a very broad term, just to give you a brief, in this life skills training, essentially we were teaching people how to set a goal, how to plan for it, how to track their progress towards it, but also helping people manage their finances in a way that they could achieve this goal. So this was a training that we had run in Iraq. We'd had some very good results. So because the team came up with this, their idea was, trying to understand which interventions are effective in graduating people out of humanitarian aid. We felt like this addition of a life skills training might actually be helpful and have an effect on the intervention. So obviously, we needed to test this, right? We can't just say that this is effective. We needed to test it. And while we were thinking about, where the resources tested, we had an opportunity from BHA to do an impact evaluation. Now, obviously, because BHA is a humanitarian donor, they understand that, some of the ethical challenges that Grace was talking about, having a pure control group in a humanitarian context is simply impossible. And so having that background in mind, Mercy Corps embarked on a co-design process with the HAEC team and to discuss what types of solutions, to tell them what it is that we had in mind, to discuss, the types of solutions we could do in this context to understand if our interventions were effective. And we landed on the A/B testing approach. So in that sense, saying Group A, all groups receive interventions. So Group A receives the package that Grace was talking about, which is food, cash, and livelihood skills and assets. And the Group B receives all of this package plus the add-on life skills training. So the idea of doing this A/B testing for us was to say, if we want to understand, if our theory is that the life skills training can actually help to graduate people faster, one way to compare this is to give one group all of the program interventions plus the life skills training and compare that to the outcome of people that received only that standard package of interventions that we talked about earlier. So that's how we kind of got around to this particular design. I'll hand you back over to Grace, who can talk us through just what we took away from this from these discussions.
Thank you, Vi. So the decision to go with the A/B testing was greatly influenced by ethical practices, and that is they do no harm. Humanitarian organizations are greatly guided by the core humanitarian standard, and one of the standards mentions that every participant has a right to receive humanitarian assistance in a correct and dignified manner. And because of the scale of people in need that we're working with, it is simply unethical to deny one group assistance for the sake of research. And A/B testing circumvents ethical concerns around this. We're also looking at practical difficulties within the context of humanitarian or emergency setting, like the one we have in Borno state, that is in the Northeast. The establishment of control groups is quite challenging. We do have various actors working here to deliver different assistance or similar assistance to what Mercy Corps is doing. And even if we're not providing an aid to a vulnerable group, most likely another NGO is doing the same. So it will be difficult to find a vulnerable group that are not receiving any form of assistance. And finally, our goal was also to understand which intervention works better. We're looking at graduation efforts here. We're just looking at A/B testing, which allows us to compare two approaches of interventions. And this will also very much help us inform and also design our future programming, our future activities, and any new proposals we may go into. So the major takeaways that we had from this exercise was it's actually very much possible to conduct an impact evaluation testing in humanitarian assistance, even if it's very much impossible to have a pure control group. And BHA's background as a humanitarian donor meant that they already understand the ethical concerns of not denying one population assistance for the sake of research. And as Masiko, co-designing the research with HAEC was very much informative and good to us, as we could be able to talk through and brainstorm through all these ethical concerns and what we were not comfortable with, what we felt was the right thing to go with, and come up with very much effective solutions that can ensure that the impact evaluation is carried on in a safe and dignified manner, at the same time holding up all of these ethical standards. Thank you so much. I will hand it over to Lloyd and the team.
Grace, Vi, thank you so much for sharing that experience from Mercy Corps in Nigeria. The next constraint and barrier we want to talk about that came up and continues to come up is the cost of impact evaluations and the perceived lack of funding to administer and implement them. And so when we had our consultation report and process, we heard a number of things around, well, they're expensive and a lot of work. We already struggle to resource our evaluations that are required by the donor. There's no funding for impact evaluations. So this raises the question, who's going to pay for it? And lastly, how are you really trying to create generalizable research? Because if so, you're going to need more money than that. The long and short of it is, in more cases than not, impact evaluations are more costly than more traditional evaluation approaches, such as outcome evaluations or process evaluations. But that doesn't mean that they're cost prohibitive. In a lot of cases, impact evaluations, while they can cost more than other evaluations, you can utilize and apply existing data to achieve those evaluations. I'll be totally frank and transparent. So the 6 studies that HAEC is funding, the average cost of those is around $200,000. And depending on where you sit within your organization, you might go, holy cow, that is a lot of money. How are we going to fund that? Folks coming from the development side might go, an impact evaluation for $200,000? That's how can you do that? That's not enough money to actually do a successful impact evaluation. But it is, and HAEC is demonstrating this. And part of the way is we're utilizing existing monitoring systems. We're utilizing targeting data, registration data. In all 6 of our studies, there's not a single one that is doing a external baseline data collection. There either is no baseline because it's not required for the methodology, or if baseline data is required, they're using targeting data, needs assessment data, and existing monitoring data to drive down the costs of that impact evaluation. And most importantly, and this is a huge kudos to BHA, is that you can, in awards that are 13 months and longer that require an evaluation at the end of the award, the impact evaluation meets that reporting requirement. So instead of doing your required end line evaluation and an impact evaluation, you can roll it under that required. And so in a way, you're kind of using existing activity funds to pay for your impact evaluation, which we would argue is giving you your organization much more valuable and important information to base decisions upon than some of the more traditional just end line evaluations that are done in these activities. And so now I'm super excited to hand it over to our colleague Maria Torres with IAPS in Honduras to walk through how they are utilizing existing data sets and staff time to drive down the cost of the impact evaluation there.
Hello everyone, my name is Maria Melo and I am part of the IAPS ADVA team who's implementing the impact evaluation of the transfer project in Honduras. And today I'm pretty excited to share with you some insights into the research cost employed by organizations like us to enhance the cost effectiveness of the impact evaluation, in this case of the transfer project. And to start with, I would like to ask the question or answer the question that what are the primary drivers of the research cost for this impact evaluation. We have identified two main costs for determining the total cost of our research, and they are the overall personnel fees for the research team and the cost associated with the primary data collection. Data collection, as I said, like is a primary driver of the impact evaluation and also any evaluations. And this includes costs such as collecting, managing, analyzing, and presenting the primary outcome data that we collect in the field. And this includes expenses related to training, data collectors, field data collection, data storage, data quality assurance measures, and also data quality review after we have analyzed the data. Sometimes data collection scores for impact evaluation can be higher than other evaluation if the study design includes a comparison group of participants who are not program beneficiaries. This means that it is key to collect from a larger sample than the project beneficiary sample, but depending on the research question that you have and also the research itself, this doesn't need to be the case, and wasn't the case for us in the impact evaluation of the transfer project. To the lesser extent, we can also mention that the personnel cost can be a budget driver for the research team, which will handle, of course, specialized tasks. An impact evaluation like this one implemented by IAPS and ADRA often require more specialized knowledge and methodologies to establish causal relationships between interventions and outcomes. And this may involve more rigorous studies design, statistical analysis, and evaluation frameworks than other standard program evaluations. On the third place, we can mention also the longitudinal data collection. Unlikely some of the non-impact evaluation that might rely only on cross-sectional data, impact evaluation like this one often involve as well longitudinal data collection to track changes over the time. At this stage, you might be wondering how these dynamics differ from other non-impact evaluation costs. And I can tell you that in the area of impact evaluation as such, the value of the technical team takes a center stage, requiring specialized expertise in advanced statistical analysis, econometrics, and rigorous methodologies. While on the flip side, fieldwork has become a more significant player in the wider landscape of M&E, and we can emphasize the need of on-site data collection and contextual of the understanding of the sites that we are visiting. In order just to continue with my intervention, I would like just to highlight here like several ways in which IAPS and ADRA has collaborated with ADRA to enhance the cost effectiveness of the transfer project impact evaluation. And to start with, I would like to mention that we have reutilized some of the existing tools. They were like a key point for us because IAPS benefited from ADRA existing data sets from pre-project diagnosis, for example, beneficiary population registry, and also ADRA's baseline survey that they collected in June 2022. By utilizing these existing data sets and methodologies, IAPS avoided costs associated with collecting new data and creating new instruments. ADRA's baseline was a key for us because we used them to conform the treatment and control groups after ADRA decoded, and that baseline survey gave us information about impact on food security indicators of the beneficiaries. On the second place, we have the use of the standardized training materials that IAPS had already developed as part of our standardized monitoring and evaluation training, which has also been used in over 26 countries. By using and adapting these training materials to the impact evaluation, we have reduced the level of effort required to develop new training materials and ensure that we were in alignment with evaluation best practices, which help us just to save some time and also resources. On the third place, during this impact evaluation, we have established differentiated roles and responsibilities between IAPS and ADRA teams. From the very beginning of the impact evaluation, we started with a strong and collaborative relationship with clearly defined roles and responsibilities within our teams. For example, from IAP side, we have provided technical and methodological input, while ADRA team has provided information about context, knowledge about beneficiaries, the country, and also the logistics that are needed to carry out the data collection. This has ensured that even when the evaluation had some challenges, we could work through them in an efficiently manner. And also, we have ensured the independence of the data accuracy by leveraging data collection systems such as enumerators, fieldwork, and logistics, and in simple words, the know-how. On the fourth place, we have incorporated ADRA's learning information collection from project beneficiaries, which means that fewer resources were allocated for tracking beneficiaries and to tracking information and aid received from ADRA, focusing, of course, on performance and costs. So to summarize, the collaboration between IAPS and ADRA has optimized resources and made the research more cost-effective by reusing existing tools, reusing existing methodologies, leveraging existing data sets, and to avoid data collection and unnecessary data collection, and also adopting efficient approaches in the project implementation. So with this, I finalize my intervention. Please let me know if you have any questions or if you'd like me to expand in any of the points that I mentioned earlier. Thank you so much and have a wonderful day.
Thanks so much, Maria. Really useful to hear how your team navigated that and identified ways to make your impact evaluation more cost effective. I'm going to start speaking about the next constraint that we hear a lot about, which is low implementer bandwidth. So humanitarian implementers are highly bandwidth constrained. These are just some examples of what we heard from them in our consultations. On the emergency side, most of us are just so overwhelmed. People are habitually running around with their hair on fire. Everyone is understaffed and people work around the clock. There's a culture of crisis. People are so desperate to get things done. And so this reality means that additional requests on implementer time is going to be really hard. So even things that seem as light as asking for a meeting or asking to share data can be quite challenging. And so the coordination required for an impact evaluation feels overwhelming. However, we did in our consultations observe that there were some organizations that are already navigating this constraint quite well. Mercy Corps, IRC come to mind. And the commonality between these organizations is that they all had these centralized research support units that could play this liaison role between research partners and their field staff in order to triage requests that would need to go to the field staff. And so effectively minimize the burden on their field staff. Now, we're not saying that everyone needs to go out and create a centralized research unit. I think there's other models that can work, but ultimately it comes down to having somebody, even if it's an individual, in that kind of liaison role that can interface between research partner and field staff and be able to protect the field staff and triage requests for them. Gary Glass at Blumont, who we'll hear from shortly, played this role really well. But in order to play this role really well, we need people that have education and training and impact evaluations. So specifically, really understand what is an impact evaluation and how is it different from other evaluation methods? What are the data requirements and what are the various design considerations? And then we also need funders to better incentivize impact evaluations to be done by implementers to in turn incentivize implementers to develop this internal capacity. And so with that, I'd love to turn it over to Gary Glass from Blumont to talk about how his team navigates low implementer bandwidth and the strategies that they use.
you very much. And I really appreciate the opportunity to talk to you all about this today. So when we discuss bandwidth constraints and how Blue Mont's able to support this kind of research, it kind of falls into 4 buckets. For us, it's about the first constraint is our teams traveling to site and where the actual monitoring or data collection activities take place, their daily workload, which is the task they're actually responsible for all the time, followed by HQ constraints that, HQ is notorious for imposing work on field teams. That's where it's one of the continuous points of contention. And then ultimately we also have external requests, which just add additional work to the field teams. So when we talk about our strategy, the very first thing is, in my role specifically, it's my job to protect our field teams. That is especially those who do the most valuable work. And in my opinion, that's our data collection officers or those enumerators that we have who are permanent members of our staff. They are constantly inundated just with their daily work. In some cases, like specific to Columbia, we have 3 data collection officers that are present in each municipality, but they have to jump around to different locations every day. So when we're talking about them and their daily workload, they're already going all over the place to interact with multiple beneficiaries on any given day. So if we say, okay, now we want to add an additional layer of data collection to your already busy schedule, they'd probably look at us and go, that's impossible. Unless, except for the fact that we say, yeah, but we're not going to force this on you. It's my job and the country director's job to look at their schedules, look at what's already being done, come up with options so they don't have to think about this stuff, and see how we can actually fit this into a schedule that's within their normal working and operating hours and doesn't add a lot, only adds value, but not a lot of extra legwork to them. And that is always possible, but the biggest problem is that it's usually communication between those different leadership entities. If they're not working together and they genuinely do not have the data collection officers or enumerators' best interests in mind, then you're going to burn those people out and they're going to leave. In some cases, the job markets in these countries or where we operate are not great, so they'll stay, but they're not going to be happy, and they might not have another option. So then you look at it and you go, you've actually done more harm than good, because you're in a way exploiting these people, and that's something that we cannot have. And that's where my interactions with the country directors and speaking about the data collection officers' roles and their daily workload and the amount of time it takes for them to get to site is crucial in our initial planning for how we can fit in additional research into their already busy schedules. So that's kind of the first step. And again, the daily workload and the travel to site go hand in hand. But then we also have HQ requests, and we can lump in donor requests, not donor requests, donor requirements. And this means analysis and reporting requirements, where research like what we're working on with HAEC, and we do similar work in impact evaluations in Northeast Syria. We have very specific requirements for reporting from the donors, right? That's not something that takes a back seat when we try to do this work. That is always our priority, is to meet the donor guidelines, make sure they're informed of the progress we're making, and to make sure that they have complete transparency on how we're implementing our programming and the progress we're making. So that can't take a back seat. So in order to do this, we also have to look at what we at HQ can pick up from our field teams to make their jobs a little easier and free them up to do this work. So if it's not on the data collection side, it could also be on the analysis side. In that case, we would pick up more of the donor required reporting and analytics, which would free up some of their time to work with, in this case, causal design and any other research partners we have. The field teams can spend more time focused on that other research, and we can pick up the brunt of the analytics and reporting, because ideally every implementing partner should have an HQ-based team that is solely there to support their field teams. And on the monitoring and evaluation side, it's individuals like myself and my team who are responsible for making sure that our field teams who fall under our umbrella of monitoring and evaluation are able to have the support they need. And whether they request it or not, if they get inundated with something, they should also feel comfortable coming directly to us and going, hey, we're getting slammed. We need a lot of help. And we should be there to be like, great, tell us what you need and give us the timeline, and we should be able to knock it out. We'll have a couple more calls or maybe just one call to figure out the specifics of what they need. And that's how we free up the time for them to go ahead and support these initiatives. Because I mean, realistically, this is incredibly valuable information, especially for the Columbia team that we're working on now actively with causal design. This impact evaluation is going to be crucial in informing future programming and possibly making decisions on existing programming. I've already spoken to our country director about this, and the preliminary results he's found to be incredibly useful. And the only way we were able to do that was to shuffle around some of our data collection officers and bring them on to support data collection for causal design while we move some other things around internally to free up those resources, right? So we move some of the work that we normally do to a different team. And then we have a dedicated team of 3 data collection officers that their sole purpose is to focus on data collection for this impact evaluation. But we can't do that if those other pieces don't work together. And then the other part that's even more unfortunate is that there's external requests. I mean, I can't tell you how many times in a month I get, I get academic organizations hitting me up going, hey, we'd really like to access this population you work with. I'm like, yeah, I bet you would. But that's not how that works. They're not there to be your little research puppets. These are people, and we're here to make sure that they're getting the services that they want. So in addition to our normal work, our field teams travel the site, which takes up their time, right, to and from. Then you've also got to look at those internal requests or actual work that we have to do to make sure we're reporting everything accurately and on time. Then we have external requests that are coming in that would further inundate our field team. That again comes to my team and my role to protect them from all these external requests. If someone has a direct line of communication to these field teams, they might not feel empowered to sit there and go, like, oh, I'm really busy. Sometimes I've seen it where teams just say, oh yeah, we can do that, because they feel pressured to do that. They're not. It's not their responsibility to do anything outside of the scope of their work. And it's our job to make sure that they don't feel anything but supported. And anyone outside of our organization is absolutely not going to be permitted to force any kind of work on them. That's absolutely not how it works. But that line of, you can look at it as a line of defense. That's part of our job in supporting our field teams, is that we filter those requests that come in, because if it isn't going to add value and we can't reasonably do the work without harming some other part of our program, we're not going to do it. I've had lots of great ideas come across, but the greatest ideas, if they're just, I don't need good idea fairies throwing things around and going, well, I haven't really thought about how we're going to do this, but I have an idea. I don't want ideas. I don't need ideas like that. I need ideas if they're flushed out and we know exactly how they're going to do it step by step. And most importantly, what resources need to be allocated and how. And that's really the only way to do it. But that's our team's job, is to protect our teams in the field. And we're going to continue to do that, but it's an ongoing challenge. And thanks again for letting me speak with you all about this today. Appreciate it.
Thanks, Gary, so much for those really useful thoughts about how teams can navigate this really a salient low bandwidth constraint that I know a lot of organizations are faced with. And with that, I wanted to extend our gratitude to all of our presenters today. Thank you so much for sharing your really practical examples of how you've navigated some of these really tricky things in humanitarian context. But before we close, I would like to share some upcoming opportunities to engage with HAEC. So first is, if these webinars have piqued your interest on whether an impact evaluation might be the right tool for a question your organization has, and if you are considering applying for either new or follow-on VHA emergency funding, then we encourage you to stop by our office hours happening every other Thursday and bring any questions that you may have about what it would look like to embed an impact evaluation in your emergency application. We'd be very happy to talk to you about it and help advise. Second, we encourage you to sign up for our newsletter released every quarter, where we regularly share resources and updates about what's going on in this space. And thanks to Katie is highlighting all the links in the chat there for these opportunities. And then finally, we invite you and encourage you to attend our final webinar in the series happening March 21st. You'll have the opportunity to hear from even more of our implementers on the HAEC funded impact evaluations and sharing more practical examples of how they designed impact evaluations in these contexts and how they're using them to answer really important questions for their organizations. So sign up today. And with that, we'll wrap it up. I hope that you took something away from today about how to navigate constraints in these contexts, and we look forward to seeing you in March. Thank you, everyone.